today to announce the presence of the first case of coronavirus disease confirmed in Nigeria. We are taking this step in order to give the clear facts to the public, which we hope you will all report accurately and be one step ahead of rumors and speculations and fabrications that tend to occupy the space, particularly the social media space at this time. And the case is that the Federal Ministry of Health has confirmed a coronavirus disease case in Lagos, Nigeria, known as COVID-19. The case was confirmed on the 27th of February 2020 and is the first to be reported in Nigeria since the beginning of the outbreak in China in January 2020. It is an Italian citizen who works in Nigeria and returned from Milan, Italy to Lagos, Nigeria on the 25th of February 2020. He actually landed here in the evening of the 24th, but by the time he got into his residence, Lagos, already 25th. He was confirmed by the virology laboratory of the Lagos University Teaching Hospital, which is a part of the laboratory network of the Nigeria Center for Disease Control. The patient is clinically stable with no serious symptoms and is being managed at the Infectious Disease Hospital in Yaba, Lagos. The government of Nigeria, through the Federal Ministry of Health, has been strengthening measures to ensure an outbreak in Nigeria is controlled and contained quickly. The multi-sectoral coronavirus preparedness group, led by the Nigeria Center for Disease Control, has immediately activated its National Emergency Operations Center and will work closely with Lagos State Health authorities, or let us say is already working closely with Lagos State Health authorities to respond to this case and implement firm control measures. I wish to assure all Nigerians that we have been beefing up our preparedness and capabilities since the first confirmation of cases in China, and we will use all measures and resources made available by the government to respond to this case. We have started working to identify all the contacts of the patient since he entered Nigeria, and even those who were with him on the aircraft. We have been in touch with the aircraft authority, the aircraft owners, to find out who his seatmates were. Please be reminded that most people who become infected may experience only mild illness and recover easily, but it can be more severe in other people, particularly those who are elderly and those who have other underlying chronic diseases. All Nigerians should therefore take care of their own health and maintain hand and respiratory hygiene to protect themselves, protect their families and others, following the precautions which I give you below. First, regularly and thoroughly wash your hands with soap and water and use alcohol-based hand sanitizer. Secondly, maintain at least 1.5 meters, about 5 feet distance between yourself and anyone who is coughing or sneezing. Persons with persistent cough or sneezing should stay at home and keep away from crowd, should not mix around in crowd, and should keep what we call the social distance. Make sure you and people around you follow good respiratory hygiene, meaning that you cover your mouth and nose with a handkerchief or tissue, or if you have none of these, sneeze or cough into the sleeve at the bent elbow, or use a tissue when you cough and sneeze, and dispose of these immediately. Stay home if you feel unwell with symptoms like fever, cough, and difficulty in breathing, and catarrh, and call NCDC, which is available day and night. That is Nigeria Center for Disease Control. And the number is 0809 and 7000 0010. It has been given before. Please do not engage in prolonged self-medication. Stay informed on the latest development about COVID-19 through official channels on TV and radio, including Lagos State Ministry of Health, NCDC, and Federal Ministry of Health. Citizens must not abuse social media and indulge in spreading misinformation and false rumors that cause fear and panic. The Federal Ministry of Health, through the Nigerian Center for Disease Control, will continue to provide updates and will initiate all measures required to prevent the spread of any outbreak in Nigeria. Thank you very much, Nati. Okay. So the limitation of flight is not what we are doing, but you already know that several airlines are already restricting their own flights into high burden countries by themselves. So we are not the one banning any flights. We haven't seen the need, and we have only just one case, one index case. We want to contain that one and prevent any other one entering the country and learn as much as we can from this particular case so that we use the knowledge that we gain here to protect our own country and defend ourselves. We are also not profiling and stigmatizing. We are not focusing on particular nationalities and saying it must be this, it must be that. It's turned out to be a clean mistake, isn't it? So we're not focusing on any area. All we know is that we look at each person on his own merit, each traveler on his own merit, and we also look at the symptoms and on the conditions and their travel history. Those are the things that concern us. I think that's all as far as this particular situation is concerned. But we're also advising people to limit congregation, particularly in areas where there has been this particular virus has now been exposed. Congregation of people, unnecessary congregation. You know that some countries have prohibited sports, sport events or concerts, anywhere where people gather together in close proximity, and where somebody might be coughing and sneezing around and releasing particles into the air. They are reducing those things. And like here now. But I don't think anybody who came here for the last 14 days from high burden country. Okay, so those are the things that we are restricting. Meanwhile, we are advising people to restrict congregation, unnecessary congregation, particularly in areas where this virus is known to have appeared. Okay, thank you. Those are the